A deadly virus is spreading across the Atlantic Ocean, and it just arrived on American soil. 3 people are already dead, 11 more are infected, and passengers from over 20 countries have scattered back to their homes, potentially carrying something with them that doctors still don't fully understand. This isn't a story from decades ago. This is happening right now in May of 2026, and health officials around the world are scrambling to contain it before it's too late. This is the Hantavirus outbreak of 2026. To understand how we got here, you first need to understand what hantavirus actually is, because most people have never heard of it, and that's exactly why it's so dangerous. Hantavirus is a family of viruses spread primarily through contact with infected rodents, their urine, droppings, and saliva. When those particles become airborne and a person breathes them in, the virus enters the body and begins attacking the lungs. There is no cure. There is no vaccine. And in the Americas, the strain known as Hantavirus pulmonary syndrome, or HPS, carries a case fatality rate of up to 50%. That means for every 2 people infected, 1 may not survive. In the United States, hantavirus has been tracked since 1993, when an outbreak hit the Four Corners region, the area where Arizona, Colorado, New Mexico, and Utah meet. From 1993 all the way through 2023, only 890 confirmed cases were reported in the United States. It was rare, it was contained, it was manageable. But the strain at the center of this new outbreak is different, and that changes everything. The virus responsible for the 2026 outbreak is called the Is virus, a specific strain of hantavirus found primarily in South America. What makes the Is virus uniquely alarming is a characteristic that no other hantavirus strain has ever been confirmed to possess. It can spread from person to person. That's right. While every other known hantavirus requires direct contact with an infected rodent to transmit, the Is virus, under the right conditions, can pass between humans. Close, prolonged contact, shared saliva, respiratory secretions, contaminated bedding. Scientists still don't fully understand the exact mechanisms, and that uncertainty is at the heart of why global health officials are so concerned right now. On April 1, 2026, the MV Hondius, a Dutch-flagged expedition cruise ship, departed from Ushuaia, Argentina. It carried 147 people, 86 passengers, and 61 crew members representing 23 different countries. The voyage was meant to be the trip of a lifetime, sailing across the South Atlantic, stopping at some of the most remote locations on Earth: Antarctica, South Georgia Island, Tristan da Cunha, St. Helena, and Ascension Island. Somewhere along the way, something went terribly wrong. According to the World Health Organization, the first passenger is believed to have developed symptoms as early as April 6th, just 5 days into the voyage, of fever, fatigue, muscle aches, symptoms that, on their own, could easily be mistaken for the flu. But by April 24th, another passenger reported to the ship's doctor with a fever, shortness of breath, and signs of pneumonia. 2 days later, his condition deteriorated rapidly, and he was medically evacuated to South Africa, where he remains in intensive care. Then came the deaths. A married couple aboard the ship died. A German woman developed a fever and malaise on April 28th, progressed to pneumonia, and died on May 2nd, the same day the World Health Organization was officially notified of the outbreak. Post-mortem testing confirmed Is Hantavirus. By May 6th, the WHO confirmed the Is strain was behind the outbreak. By May 8th, 8 cases had been reported, 6 confirmed, 2 suspected, and 3 people were dead. By May 12th, that number had climbed to 11 confirmed or suspected cases, and the WHO's Director General issued a sobering warning. Given the long incubation period of this virus, which can range from 4 to 42 days, more cases could still emerge. Here's where the story takes a turn that directly involves the United States. As the ship made its way toward the Canary Islands, passengers began disembarking and flying home to more than 20 countries around the world before the full scope of the outbreak was even known. 18 American passengers were put on a State Department flight and transported to the University of Nebraska Medical Center in Omaha, home to the country's national quarantine unit. 2 additional Americans are being monitored and treated at Emory University in Atlanta, Georgia. 6 U.S. states, Arizona, California, Georgia, Texas, Virginia, New Jersey, and Utah, are actively monitoring individuals who were aboard the ship. One American passenger has tested positive for hantavirus. Another is showing symptoms. The CDC has classified its response as a Level 3, the agency's lowest emergency designation, and has stated that the overall risk to the American public remains extremely low. Routine travel, they say, can continue as normal, but not everyone is reassured by that message. Because here's the part of this story that isn't getting nearly enough attention. In 2025, the Trump administration eliminated federal funding for a research program specifically designed to study how viruses like Hantavirus jump from animals to humans. The program, called the Centers for Research in Emerging Infectious Diseases, was run through the National Institutes of Health and included a pilot project in West Africa focused directly on the Andes virus. In its final funding filing, the research team warned that cutting the program would make the United States and the world more vulnerable to viral pandemics. The funding was cut anyway. Scientists are now pointing to that decision as the backdrop to this very outbreak. Experts note that we still don't fully understand how the Andes virus transmits between humans, whether it requires close physical contact, or whether it can travel through respiratory droplets in the air, like a cough or a sneeze. That gap in knowledge exists, in part, because the research to fill it was never completed. As one expert put it, we were not in a good position to dismiss hantavirus just because it had never caused a large outbreak before. And now it has. So, what should the public actually know going into the weeks ahead? First, hantavirus pulmonary syndrome is not easy to catch. The vast majority of cases are contracted through direct exposure to infected rodents cleaning out old sheds, barns, or garages where rodents have nested, or spending time in areas with heavy rodent activity. The Andes virus does carry the rare potential for human-to-human transmission, but experts emphasize that this requires close, prolonged contact with a symptomatic person. Second, the incubation period is long. Symptoms may not appear for up to 42 days after exposure. Anyone who was aboard the MV Hondius or who had close contact with a passenger could still develop symptoms in the coming weeks. That is why global health authorities are urging all former passengers to monitor themselves and seek immediate medical care if they develop fever, fatigue, muscle aches, or any respiratory symptoms. Third, early treatment matters. There is no specific antiviral medication for hantavirus, but early supportive care, including intensive care support and supplemental oxygen, significantly improves survival odds. The faster a patient gets to a hospital, the better. And fourth, this outbreak is a warning, not just about hantavirus specifically, but about the broader fragility of our global public health infrastructure. In a world where a single cruise ship can carry 147 people from 23 countries to some of the most remote locations on Earth and bring a deadly virus back with them, the ability to study, detect, and respond to emerging infectious diseases is not optional. It is essential. As of May 2026, the MV Hondius outbreak remains an active developing situation. Investigations are ongoing, contact tracing is underway across multiple countries, and health officials around the world are watching closely to see whether the incubation period produces any additional cases. 3 people have already lost their lives, more may yet be infected, and somewhere in the gaps between the research that was done and the research that was cut lies a question this country is going to have to answer sooner or later: how much is it worth to be prepared?